P23. Knowledge, access, power. P23. Wellness and understanding at your fingertips. P23. And that's no cap.
Welcome to a very special episode of Demystifying DNA. Today, we are inviting a very special guest, Know Your Lemons. I'm your host, Dr. Tiffany Montgomery, and we are going to delve into the crucial intersection of genetics and breast cancer awareness with our special guest, Dr. Corrine Ellsworth-Beaumont, CEO of Know Your Lemons. Dr. Corrine Ellsworth-Beaumont, MFA, PhD, is a visionary digital designer who leverages technology and design to revolutionize breast cancer detection through the work of her global charity, the Know Your Lemons Foundation. Since 2017, her impactful campaign, app, and global educator program has reached over 1.85 billion people in 34 languages. Her foundation supports the work of a robust global partnership network that delivers Know Your Lemons breast education on a grassroots level in over 60 countries, saving lives worldwide. Beyond her groundbreaking work, Corrine serves on international panels, including the WHO Global Breast Cancer Initiative, and has spoken at prestigious events like the United Nations Conference. Her TEDx talk highlights her innovative approach, earning a standing ovation. Alongside her professional endeavors, Corrine enjoys travel adventures with her daughter. Welcome, Dr. Beaumont, to my show. Can I call you Corrine?
Yes, you can. Thank you, Tiffany, Dr. T.
You're welcome. Just call me Tiffany. Just call me. I'm so happy to have you. And thank you for joining us as we debunk myths and explore the vital role of genetics in understanding breast cancer, risk, and prevention. Together, we aim to empower you with essential knowledge to protect your health and well-being. Corrine, I have to ask you, this is a phenomenal organization. You've touched so many lives. What made you start this non-for-profit, Know Your Lemons?
So when I was starting my master's degree in graphic design, I lost my second grandmother to breast cancer. And at that point, I realized, I think this is in my family. I think this is a health issue I should know more about. And I realized I didn't know anything about breast health. So I went online, I looked up a lot of information, and went to a cancer library in my area and said, hey, I'm in my early 20s. I have a family history of breast cancer. What should I be doing? And they said, well, we don't get people your age coming in here asking these questions, but here's a book, here's some leaflets, here are some websites. And I ended up leaving with more questions than I had going in. And I was also looking at this through the eyes of a designer and looking at the materials. And, I don't know about you, but whenever you're at the doctor's office and you see pamphlets or the 5-year-old issue of People magazine, most of us are picking up the People magazine when we're finding out how Brad and Angelina are enjoying their lives in France, right? So we do not go to the medical information, right? We'd rather read old kind of like celebrity news than, learn about the 5 facts concerning whatever body part. So I thought design can make a big difference. As a designer, I can make this information interesting so it doesn't require 2 family members dying before we start to seek this out. What if this information became appealing? What if it became engaging and interesting to look at? So that's where I started out with, the basic questions I had were, do I have an increased risk for breast cancer? When should I start getting mammograms? People say feel for a lump, but what does a lump feel like? Because there's lumps in our body everywhere, because our bodies aren't just things of goo, right? We've got anatomy, and especially with breasts, right? We've got milk ducts and lymph nodes and like all kinds of things. So just being able to understand those questions is where I began. So I started working on it as part of my 3-year master's project. I worked alongside physicians. I talked to patients. I really did everything I could to be in someone's shoes, just to understand the diagnostic process, what are the different kinds of symptoms. And through that research came up with a whole new way of being able to talk about breasts by using lemons as a visual metaphor, a visual substitute for that, so that you can get really specific information to show this is what this symptom looks like without ever having to show a breast. You can show it on a lemon instead, which is great because lemons have nipples, lemons have skin pores. And if you cut a lemon navel to navel, it resembles breast anatomy. So there's a lot of really interesting things you can do when you have a new way of looking at the breast, because then you can show people actual symptoms in detail without ever having to be censored.
And we talk a lot about the education part. I think that is phenomenal. When we're younger, we joke about breasts, or, we refer to them without saying the word breast. I've heard people call them melons. But your approach to call them lemons was very unique. It stood out to me, and it caught my attention. It helped me see the similarities that you just don't see. I think because the lemon is smaller, and most girls, especially when they're younger, they kind of want more than just the lemon amount. Does that make sense?
Yeah, that's a great thing. So when I started off looking for the metaphor, I photographed 42 different objects. I did melons and jugs and cones and all kinds of things. And as I was doing this, I was like, okay, melons are known for size. So if I use melons, this is sending the subliminal message of breast cancer is for larger breasted women. So I'm like, I have to take that out. I can't use melons. For things like milk jugs look different in different parts of the world, right? Not everyone has milk jugs. So I'm like, nope, that's not going to work because it's not going to be able to translate globally. So I wanted to find an object that people were familiar with that hadn't already been used with breasts. So that way it could be a fresh metaphor that didn't have something else attached to it. But something else really interesting that happened when I was shadowing at an imaging center, and I was talking to the mammography technician and talking to the radiologist and asking questions about what does a cancerous lump feel like? Because a lot of the literature just said, feel for something different. You'll know it when you see it, type of thing. And I'm like, well, that's not a lot of information just to say like, you'll know it when you see like that. What information is that? And so when I was talking to the technician, because she had felt many lumps as she was doing her work, and I said, is it squishy like a grape? And she says, well, it can be that size. And I'm like, no, like how does it feel? And she says, well, it's often hard like a nut. And when she said that, I thought, or a lemon seed. And then that's when the metaphor became complete. Is it if you're feeling something, anything that feels different to anything else in the breast needs to be investigated, right? Cancer doesn't just say, I present in this one way for everyone. But as the general rule, cancerous lumps are hard, and the longer it is there, the more immovable it becomes. And so if you find something that's hard and immovable, that's definitely something that needs to be referred to a doctor. Sometimes these things are cysts, which is a harmless thing that happens in the breast, but you only know these answers when you get it followed up through testing. So, having that metaphor of the lemon seed and a lemon looking like a lemon and the inside of a lemon looking like breast anatomy, you could use it to educate on lots of different aspects of breast health.
Which is amazing. And I'm just going to ask you, can you elaborate on your organization's commitment to not just being informative, but also emotionally supportive in its engagement with individuals? And I want to just say individuals because we know breast cancer can affect men and women, right? So we want to be inclusive. I just want to know, how do you foster that collaboration and that sensitivity?
Yeah. So because we use lemons, and whenever we show the lemons, they're not attached to a body. They're just lemons on their own. So because of that, we can communicate with any gender. because we're focused on lemons and not a body. So that's really useful. Also, because we're focused on lemons, it works for any ethnicity. Because again, we're not calling out a specific ethnicity. So we're not calling out a specific gender. We're not calling out a specific ethnicity. We're not even calling out a specific age when we're doing this, because we're using lemons as the vehicle, and lemons are not associated with an age or ethnicity or gender. So that makes it a very neutral way of discussing it. So that's why our campaign is so universal, and we're able to use it around the world in so many places. In some parts of the world, lemons are green. So our Know Your Lemons campaign has green lemons that feature in that. So that's one of the adjustments that we make. But we use a lot of really colorful graphics, which makes the information friendly. So a lot of cancer related publications are very clinical looking. They're very serious. And anything important is written through text. So for people who don't have time to read a lot of things, which is most of us, for people who aren't interested in reading a lot of text, which is most of us, like the message becomes inaccessible at that point. And then for people who have lower literacy, then it really becomes inaccessible. So our goal is to make it more accessible, to make it more universal. Is how can we leverage visuals to do most of the communication in a way that requires very little text, is colorful and friendly in the way that it looks, so it's more approachable, and then also is universal, so it can appeal to all these different age groups and ethnicities and genders.
So before I get to the fun stuff, I'm going to ask you, just as fellow female business owner with a vision to fellow business female owner with a vision. I know I have, and I have to assume you have too, also heard people say, why would you do this? Or how is it going to work? Or this is silly.
Yeah.
And for those people today, I'd like you to share some success stories where your organization's friendly, inclusive, dynamic marketing approach has made a significant impact on individuals' lives with making this information more acceptable and accessible.
Yeah, definitely. I'd love to tell you a story about a woman named Bryony in Australia. So she was at her doctor's office getting ready to check out at the counter when she noticed our 12 signs of breast cancer poster up there. And I realized we're on a podcast, so I'll just pause for a minute to say, if you haven't yet, go to knowyourlemons.org and see the image that I'm about to talk about. So this is the image that has saved a lot of lives around the world. And what it is it's 12 lemons inside of an egg carton, and each of those lemons shows a different symptom of breast cancer. So this poster was hung up at this doctor's office. As she's checking out, she looks at the poster, and one of the lemons catches her eye, which is a dimple. So one of the symptoms of breast cancer is having an indentation in the breast. And she looks at that and says, well, hold on, I have that on my breast. Is that a symptom of breast cancer? And so immediately she brought it up with her doctor. And 20 days later, she started her first chemo treatment for stage 2 breast cancer. Now, if Bryony had not have seen that poster, how bad would it have needed to be before she recognized this was a problem? It was painless. There were no lumps. There's, as we get older, we have other dents and dimples in our body that show up, right? And so she just thought, oh, this is aging. And so that's one story. And there are many stories like that of people saying, because I saw this image, it gave me information and it gave me confidence because it was communicated so clearly that I knew I needed to do something about it. So there's also Jessica in France. She saw our image on social media and decided, you know what, I need to get better at my self-exams. So she decided after seeing that image, I'm going to be regular about doing my self-exams. A couple of years later, she notices a lump. She goes to her doctor. She's in her early 30s. And he says, you're statistically, this is unlikely. you're too young for breast cancer, so I'm not going to refer you for testing. So she's sent away. She comes back again and says, I really think that there's an issue here. And he's again tells her, no, I don't think this needs investigated. The third time she goes back, and they said, okay, fine, we'll refer you for an ultrasound. So she gets an ultrasound. The technician looks at it and says, we definitely see something there, but it looks harmless to us. But what Jessica knew was that she was now showing 3 symptoms of breast cancer. And she's like, there's no way I'm showing 3 symptoms of breast cancer and this thing that's appearing is harmless. She says, I just knew, combined with the information she had and her instincts, something was wrong. And so they said, okay, do you want a biopsy? And basically the biopsy was offered as a way of just being like, and then you leave us alone. And she's like, yes, I want a biopsy. So they do the biopsy, and it was stage 1 triple negative breast cancer. Now, triple negative breast cancer is a very aggressive form of breast cancer. It can grow very quickly, and catching it early is really difficult. So for her to have found triple negative breast cancer at stage 1 is pretty significant. And that was because she knew the symptoms, she knew her body, she knew what was normal for her and that this was different, and she knew how to advocate for herself. So, we hear that story time and time again. People see our work, they recognize they have a problem, they go to the doctor, sometimes they're dismissed, but they persevere. They know that something's wrong, and then they insist on getting the testing they need, and that's how they're diagnosed early. And when people are diagnosed early, that makes all the difference in survival. So when someone's diagnosed at stage 1, the survival rate's like over 99%. When someone is diagnosed at the latest stage, stage 4, it's more like in the 32% range. So there's a huge difference in saving a life if you can get people diagnosed early. And the 2 things for that are knowing what's normal for you by, practicing regular self-exams just to get to know your normal. And the second one is getting screened according to your risk. So if you're average risk, you should start getting a mammogram every year, age 40. And if you're at higher risk, then you might need a breast MRI with that, or you start mammograms at an earlier age. So knowing that information is really important. And our Know Your Limits app will help people understand what those risk factors are, what screening plan you should discuss with your doctor, and send you monthly reminders of how to self-exam, what each part of the breast feels like, details on each symptom. It's really useful.
I don't want to stop you, Corrine, but did I just hear you say you have an app that we can download? It'll remind us of when to do our self-exams. It will have the images of the lemons and what we should look for. And it will be an interactive way for us to look at what's going on with our body. And you designed this app.
Yes. And it's free.
How much does it? It's free.
It's free.
Wow. So it's free. It's on Apple, I'm assuming on Android, and maybe Google Play Store.
Yeah.
Play.
So, yep. It's for any device. We have it. So it's free. We don't collect any health information. That's your business. It all stays on your phone. And we've won several Webby Awards, which is like the Oscars of the internet. We're nominated as top 5 health and fitness. So get it. It's really life-saving. Several people have said, I didn't know how to do a self-exam until the app, and now I feel more confident in what I'm doing. Whereas before, I kind of was like, there's lumps, I don't know what to do. And they kind of, decide I'm not engaging with this anymore. It's too confusing. We've even had someone that said, I found my lump because of the app teaching me how to do self-exam. So
I'll have to admit, kudos to you. When I heard about this app, I even had my husband get it because I'm like, you can help me look for stuff. Like, we need to be looking at.
Yeah.
We're not going to write it off as just getting older. Like, we're going to be on the lookout because I do agree early detection is the key. So for all the work that you've done.
Until we have a cure for all the different types of breast cancer, the best thing we can do right now to save lives, absolute best thing we can do, is educate ourselves and take steps for early detection.
You are amazing. So let's get to some fun stuff, okay? A lot of people hear a lot of myths about breast cancer. We know it's so serious. It can be difficult to talk about. So I'm going to get into a couple of myths. And the first one is breast cancer is caused by wearing underwire bras.
You know, wouldn't it be great if we could just get rid of underwires and it would solve so many problems? Like, wouldn't that just be nice to be like, you know what? I'm not going to wear an underwear bra and now breast cancer is solved, right?
So
Yeah, we don't live in that world. That's not how it works, right? Like underwire bra, this may be uncomfortable, but they're not cancer
that's a myth.
causing. Um, that's a myth. And anyone who's trying to sell you a bra that's gonna like prevent breast cancer, they're trying to make money off of you.
Good to know. Now,
So
what about this one? And I think we
yeah,
kind of talked about this one, but we're going to go myth or fact.
okay.
Breast cancer only affects women.
Ask Beyonce's dad that question.
Definite myth.
He'll tell you that is not true. That is not true. This is because both men and women have breasts. Both men and women have breast tissue. It's women are able to have milk producing facilities with their breasts, but men do not. But both men and women can get breast cancer. So it's rare, but it does happen. So 1% of people diagnosed with breast cancer are men.
Here's one that I get all the time. Breast cancer is caused by deodorant. If we take the aluminum out of our deodorant or put on baking soda instead of deodorant, we'll be able to stop breast cancer.
Again, what a wonderful world to live in, that if we can just switch our deodorant, like breast cancer goes away, right? That's not how cancer works. There have been several studies that have looked at it that have said that there's not a correlation between antiperspirant and breast cancer.
One of my personal favorites, and I believe me, I'm not making this up. These are things that we hear, that we get a lot, so I would like to hear from you on it.
Mm-hmm.
Breast cancer is contagious. It can be spread from person to person. So if I have breast cancer and my husband touches my breast or we're intimate, can he contract breast cancer?
No. So cancer is under the category of non-communicable diseases, right? So non-communicable means you're not transferring it from person to person. It's not airborne. It's not like you can't transfer it with fluids. That's not how cancer works. So cancer is where a cell doesn't normally grow and divide and die as it should. It doesn't follow the normal pattern of how cells develop. So it's a very broad term. There's lots of ways cells can go awry. So cancer and different types of cancer are all labeling different ways cells go awry. So this is why, like with breast cancer, there's not just one kind. There's several different kinds of breast cancer. And they're all treated a little bit differently. So kind of knowing that is also useful. That's another myth, is that there's just one kind of breast cancer, but there's many kinds of breast cancer.
Last one. Breast cancer is always hereditary. So I don't have a family history of it. It's not something I need to be concerned about because you can't get it if it's not hereditary.
You know, this is the most prolific myth. And I think the reason why this myth is so beloved is because it feels like protection. And so this is a statistic that's going to surprise people who are hearing this. 85% of people diagnosed with breast cancer have no family history of it. 85% of people diagnosed with breast cancer have no family history of it. They're the very first person in their family to be diagnosed. So the number one thing we hear when we're going out, we're educating people and saying, hey, are you getting your mammogram? They say, well, I could, but it doesn't run in my family, so I don't really have to worry about it. If you're a woman and you are getting older, congratulations, you need to worry about it, because 1 in 8 women will get breast cancer in their lifetime. So that means if you have a room of 75-year-old women, and there are 8 of them, 1 of them will have had breast cancer at some point in their life. So that's this idea of like it doesn't run in my family, and so I don't need to worry about it, just isn't true, because most people don't. And this is why you hear so many people say, I didn't think it could happen to me. It's not in my family. And it's growing, and it's happening at younger ages. And so, being aware of that and recognizing just for being a woman and just for getting older, those are your two biggest risk factors for breast cancer. If you find a way to stop aging, then sure.
I
You don't
don't
need to
think we
worry
want
about it,
to. We don't want to. We want to be here. We don't want to
right?
stop
Like,
aging.
until we figure out this like not aging thing, like we need to be getting our mammograms. We need to be doing self-exam.
I will say that it is difficult. It's challenging. When I separate being a scientist and being, the super smart lady and the curious lady, at the end of the day, when I'm just wife, mom, and just Tiffany, it can be hard. You think it's going to hurt, and then they have a lot of changes. Like you said, it keeps changing ages.
Uh-huh.
So it used to be the standard of care was start screening at 45. Then it went to 44. Now they're saying 40. And I'm like, it keeps going, but we're having more precedence of it, and earlier detection is the key. There's no pattern to it, as you stated. It's unpredictable. So what can we as women do to get over the fear of that first mammogram or the pain that we think might be associated with it? And now you're talking to me. So convince me to get that mammogram.
Well, I'm going to give you some secrets. I'm going to give you
Okay.
some tips. Okay. If you are menstruating, the best time to go is a few days after your period ends, because this is when your breasts are less tender. So you probably noticed the last half of a menstrual cycle, your breasts get a little talkative. They're like, hey, I'm here. I'm uncomfortable. Oh, right. And you have tenderness, you have some swelling, you have like some temporary lumpiness. That is normal. That is hormones in the body trying to prepare you for a potential pregnancy, right? And then it's like, oh, we're not pregnant, and then hormones go down. And anyway, so there's that breast cycle pattern to know about. So the app has a period tracker in it. It will send you reminders to do a self-exam at the ideal time every month. If you don't menstruate, it will send you a reminder on the first of every month to do it. So that's something to know when you're scheduling your mammogram. And usually when you call to schedule a mammogram, they will ask you that question of when was your last period. So that's tip number one. Tip number two is to maybe take some ibuprofen 30 minutes beforehand if you're really concerned about pain. And so the last one is, as women, we do far more painful things than a mammogram. If you have had a bikini wax, you can handle a mammogram, right? Like if you can walk in heels all day, you can handle a mammogram. Like this is nothing. This is nothing. I've had mammograms where I've definitely felt it, and some mammograms where I was like, that's it. So sometimes it depends on the technician that you have. If you say, hey, this is my first mammogram and I'm concerned about discomfort, you can let that technician know and say, I really appreciate if you can, be as, I mean, they're going to be doing their best anyway, but sometimes just you communicating that can help. But the best comparison is to think about it like getting your blood pressure taken. So, you have that blood pressure cuff around your arm and you feel it and it gets tight, but it's not like painful. And then you have that release. That's really what a mammogram is like. You've got that compression, that tightness, and it only lasts for like a few seconds. So if for women who no longer menstruate, then really you can kind of go in at any time to get a mammogram, and that's not going to differ too much. Some women still have like hormone cycles that are happening even though they're not menstruating. So just knowing your body, know if you have kind of this breast cycle and there are times of the month that are more tender or not, whether or not you're menstruating is good to know. But I would say don't let a small fear of potential pain, not all mammograms are painful, put you off from doing a mammogram. Think about the protection and help that's giving you, because chemo is a lot more painful than a mammogram, right? And if you can get diagnosed really early, you can avoid chemo. So it's that exchange of maybe a little discomfort now for, protecting your health, protecting your financial health, by doing this. Mammograms are free. They're included with any healthcare insurance. If you don't have insurance, your state will have programs to help you get screened. So there's fewer and fewer excuses now to avoid mammograms. They're less painful than they used to be. They use far less radiation than they used to. It's very, very minimal amounts. It's very safe, low dose, and it can save your life. So that being said, it's also good to know if you have dense breast tissue, and that's something that you find out with your mammogram. So dense breast tissue isn't perkiness. It's not something that you can feel or see. It has to do with the makeup of your own breast tissue. Black women tend to have denser breasts, and it can make a mammogram harder to see through that tissue. And so they have 3D mammography, which is available in a lot of places that can help see through dense breast tissue a little bit better. And then there's also supplemental ultrasound that can help with that as well. So it'd be good to talk to your doctor to find out what level of breast density you have. You only find that out by doing a mammogram. So you need to get that first mammogram done to find out if you have dense breasts. And if you do have dense breasts, talk to your doctor about if you need additional imaging to make sure that you're getting screened according to your breast type.
Thank you so much. You have convinced me. I'm going to do it. I'm going to do it. I'm going to do it. We're going to talk about it. All right. So thank you. Last question for you. Well, okay. I cheated. It's like a twofer. Okay. It's a 2-for-1.
All right.
The first one, what advice does Know Your Lemons, and in particular you, have for other organizations looking to adopt a similar approach in making health information accessible and inclusive in the context of wellness?
Yes. The first thing is to start by walking in their shoes, work with the people that you're wanting to educate, see it from their point of view, get their thoughts on things. If you're an organization that's looking at how can we better educate for health, that's where you need to start, is having the people you're wanting to educate on board with you as you develop things. That's really important. For Know Your Lemons, we have programs that make it really easy to bring it into the workplace. We have a schools program that we're doing right now, testing out in some schools, which is going really well, which is because we never show breasts, we can show this in schools fairly easily. It's not part of sex education. Breasts are not a sex organ, as sexy as they may be to some. Breasts don't help you make a baby. Like, technically, they don't help you make a baby. And so this is health education we can do outside of sex ed, which is needed. And if we learn about this in school when we're already designed to be learning about our bodies, we learn about every part of the body except breasts in school. And so it's created this knowledge gap of people not sure if they should do mammograms, or thinking I don't have a family history of it, so I'm fine, or I don't know how to do self-exams, or I don't understand breast anatomy, so I don't know what I'm feeling. We can tackle that in schools. And then the students have the assignment to go home and share this information with their family and, ask their mom, have you been getting your mammogram? What can we do to support you to get this done? Do I need to remind you? Can I help you? Because having a child come home and say, I care about your health and I want you to look after yourself is far more convincing than any commercial or billboard would ever be. So, how do we start these conversations at home about the most common cancer in the world that can save lives if we can just detect it early through education? So we work with companies to do corporate wellness programs. We work with schools. We work with healthcare providers in being able to educate their patients more effectively. So, reach out to us. We've already created the thing. We want you to use it.
Which is amazing. And then my last question, you talked about this free app, which is just mind-blowing, award-winning, useful and helpful. You've talked about all the free education services that you provide, but how can our listeners and other business owners that I know are listening to my podcast support your efforts? How can we help increase your reach?
Yes. So there's lots of ways to get involved. So the first thing we say is we're here to educate you, and then you can help us educate others. So download the app, you use it, do the screening assessment, all those things first. And then once you're educated, donate, become a monthly donor. The app is available for free because we have people who very kindly donate funds to us. Um, and then as a company, you can contact us about bringing in the wellness program. You can buy materials from our shop to educate your employees. We have cute T-shirts. We've got blankets. We've got all kinds of really fun things on our Know Your Lemon shop on our website. So there are lots of different things people can do, and you can also volunteer. So you can become a Lemonista with us, and you can take our online training course, and we will teach you everything you need to know about breast health. We give you teaching materials, and you can come in and become one of our global Lemonistas, join our global network, meet people from around the world who also care about women's health. Because this is a topic that's important to them. So we have breast cancer survivors who are Lemonistas. We have people who have had it in their family and want to make a proactive difference in it. And people who just care about the cause. So, we'd love for you to volunteer. We'd love for you to donate. Get the app. And if you own a business, bring our wellness program into your company and improve the health of your employees.
Thank you so much for sharing. I want to be respectful of your time. I could go on and on. I know I still have
This is great.
a battery of questions. So we'll have to do this again. Post my mammogram, and we'll talk about the excitement of that first mammogram and that kind of thing.
That'd be great.
I want to thank you humbly for joining us. It's been very enlightening and informative, encouraging. And I know you've got a world to save, right? So I'm going to let you go as we wrap up this enlightening discussion on genetics and breast cancer awareness with Dr. Corrine Ellsworth Beaumont, CEO of Know Your Lemons. We extend our heartfelt thanks to each of you for tuning in. Remember, knowledge is power, and understanding the genetic aspects of breast cancer can make a significant impact on early detection and prevention. This is how we save lives. Stay informed, stay proactive, and join us on the journey to better health. Thank you for being a part of the Demystifying DNA and Know Your Lemons collaboration. I want to encourage each of my listeners. I've never asked you for anything. Go to knowyourlemons.org. Download the app, become familiar, and partner with this amazing organization. Thank you all, and be well until next time.
Thanks, Tiffany.
Thank you.
P23. Knowledge, access, power. P23. Wellness and understanding at your fingertips. P23. And that's no cap.